Hello friends, Nerd Medico this side. Today we are going to study Barrett's esophagus. Don't forget to like, comment, share and subscribe with your friends. So today we are studying Barrett's esophagus. What happens in Barrett's esophagus? There is a metaplastic change in the mucosa of lower end of esophagus. What happens? There is the metaplastic change in the lower end of the esophagus from squamous epithelium to columnar epithelium. On microscopic examination, we see intestinal metaplasia. What happens? We can see intestinal metaplasia, as we can see presence of acid mucin containing goblet cells. So what is the characteristic features of the Barrett's esophagus? We can see metaplastic change in the lower end of the esophagus from squamous epithelium to columnar epithelium. On microscopic examination, we see intestinal metaplasia. The key word intestinal metaplasia, as we can see goblet cells in the lower end of the esophagus. Now, how Barrett's esophagus is classified? It can be classified on the basis of length or on the basis of histological examination. On the basis of length, we classify it on classify if less than 3 centimeter of the metaplastic change has been occurred, then it is called as short segment Barrett's esophagus. What? Short segment Barrett's esophagus. If more than 3 centimeter of the metaplastic change have occurred in the esophagus, then we call it as classic Barrett's esophagus. Okay, now it comes on the basis of histology. We can classify Barrett's esophagus on the basis of gastric type, intestinal type or junctional type. What cells we can see on the histological examination, then we tell it as a gastric type or intestinal type or junctional type. In gastric type, we see chief and parietal cells. On intestinal cells, we all know we can see goblet cells. And on the presence of glands like mucus glands, we call it as junctional type. Okay, this looks very non-pretty. Mucus glands. If we see the mucus glands, we will call it as a junctional type. Now comes the clinical manifestation. What clinical features we will see in the Barrett's esophagus? First of all, we will see the features of GERD, as it is the most common complication of the GERD, gastroesophageal reflux disease. Then the features of GERD will be present. So the basic question: what are the features of GERD? The mnemonic is rarer. What are regurgitation? It's a very basic. Regurgitation is a basic complaint of a GERD. Then comes epigastric pain in the region of epigastrium, epigastric pain. Also retrosternal heartburn. Retrosternal, that is behind the sternum bone, we have the burning sensation. So retrosternal heartburn. Okay. Next are the features of GERD, then hematemesis, and it is also more common in males than females and more common in white. Okay, now comes the risk of malignancy is 40 times in Barrett's esophagus. So basically, Barrett's esophagus increases the risk of malignancy up to 40 times. So what is the management of Barrett's esophagus? Anti-reflux treatment, that is PPI, and all the treatment we give for GERD. Also, lifestyle modifications like cessation of smoking should be stopped, and obesity should be decreased. Alcohol intake should be ceased. Alcohol intake should also be reduced. Now next we should always do biopsy and endoscopy every 1 to 2 years in the case of Barrett's esophagus to rule out dysplasia and adenocarcinoma. As Barrett's esophagus is increases the risk of malignancy, there is there is like increased chances of conversion of malignant transformation. So we have to do biopsy and endoscopy every 1 to 2 years. Thank you so much. Don't forget to like, comment and subscribe. Thank you so much watching till here.